Hi, my name is Kessler Hurd. I'm a third-year medical student from The Ohio State University College of Medicine. And I want to thank the members of SAGES for allowing me the opportunity to present our project on the predictors of symptomatic, non-emergent early ulcers and strictures after Roux-En-Y gastric bypass. I have no disclosures. Roux-En-Y gastric bypass is an effective treatment for weight loss in patients with obesity. Marginal ulcers and strictures are common complications following surgery. It occurs at a rate of about 1 to 16% and is categorized as early within 90 days or late greater than 90 days. Therapeutic interventions for ulcers and strictures differ in terms of the frequency of interventions such as upper endoscopy. This may impact patient satisfaction as well as healthcare costs. However, the etiology of early marginal ulcers and strictures is still unclear. The aim of the study was to determine factors associated with the formation of early marginal ulcers and strictures. Also, to perform a separate sub-analyses on early marginal ulcers and early marginal strictures. This was a retrospective review at a single academic center. We looked at all patients who underwent primary Roux-En-Y gastric bypass and a screening pre-surgery upper endoscopy. Our experimental group included symptomatic patients who had a marginal ulcer or stricture identified by endoscopy after surgery, and our control group included asymptomatic patients who were not scoped within 90 days of surgery, and those who had symptoms but no gross pathology identified. We obtained data through review of the electronic medical record, and it included demographics, past medical history, gross and microscopic results of screening EGD, peri and postoperative data, as well as discharge medications. Our results showed that of a total of 311 patients, early marginal ulcers and or strictures occurred at a rate of about 10.3%. The median time to presentation was 45 days after surgery, and compared to control, there was no difference in demographics, past medical history, or social and medication history. Additionally, there were no differences in intraoperative or intraoperative characteristics or perioperative complications. However, findings on screening endoscopy show that those with marginal ulcers and strictures were more likely to have esophagitis, and a smaller proportion had hiatal hernias. Additionally, those with pathology were more likely to be taking sulcrafate at discharge. Multivariate analysis showed that sulcrafate use at discharge was associated with increased odds of an early marginal ulcer and/or stricture, while older age and hiatal hernias were associated with decreased odds. Now, when focusing on early marginal strictures, it occurred at a rate of about 7.9%, and the median time to presentation was about 45.5 days. Compared to controls, there was no differences in demographics, past medical history, or social and medication history. Additionally, there were no differences in gross and microscopic findings on screening endoscopy or perioperative complications. However, stricture formation was associated with the use of a 4.8 millimeter stapler height, as well as sulcrafate use at discharge. Multivariate analysis showed that sulcrafate use was associated with increased odds of stricture formation, while baseline use of NSAIDs was associated with decreased odds. Now, when focusing on early marginal ulcers only, it occurred at a rate of about 3.6%, and the median time to presentation was 41.4 days after surgery. Compared to control, there are no differences in demographics, past medical history, or social and medication history. Additionally, there were no differences in gross and microscopic findings on screening endoscopy or intraoperative characteristics. Perioperative dehydration requiring IV fluid boluses was associated with ulcer formation. And interestingly, celecoxib use was inversely associated with ulcer formation. Multivariate analysis showed that perioperative dehydration was the only predictor of early marginal ulcer formation. However, this must be interpreted with caution due to the small n in this group. In summary, ulcer and stricture occurred at a rate of 10.3%. sulfate use at discharge was associated with increased odds, while older age and hiatal hernias were associated with decreased odds. Early marginal strictures occurred at a rate of 7.9%, and sulfate use at discharge was associated with increased odds, while baseline NSAID use was associated with decreased odds. And early marginal ulcers occurred at a rate of 3.6%, and perioperative dehydration was the only positive predictor. Limitations in this study included its retrospective design at a single institution, its small sample size, and the fact that we only examined symptomatic patients and only counted symptomatic patients with gross disease. In conclusion, this study demonstrates that predictors of early marginal ulcers and strictures may differ. And given the prevalence of these complications and difference in their management, identifying patients at risk is important to mitigating their formation. Thank you.